Thank you, Madam Speaker. Good afternoon, Madam Speaker.
Good afternoon, sir.
Thank you, Madam Speaker. Through you, Madam Speaker, just for clarification to the good chairman, Vice Chairman of the Judiciary Committee on the amendment. Through you, Madam Speaker.
Please proceed.
Thank you, Madam Speaker. So through you, Madam Speaker, in lines 91 on, so when a prescribing practitioner prescribes the scheduled medications to the long list of people that the lines tell us that they can prescribe to, I see there is a 72-hour period for which the medicine, the opioid, can be prescribed. Through you, Madam Speaker, was there a reason to have chosen the 72-hour period? Through you, Madam Speaker.
Representative Stastrom.
Thank you, Madam Speaker. Madam Speaker, I'll confess I do not know the answer to that question. As was indicated by the ranking member of the Judiciary Committee, most of this amendment language actually came out of the Public Health Committee and was combined into a judiciary bill in the Senate, so I do not have an answer to that question. Through you.
Representative Srinivasan.
Through you, Madam Speaker, as you're well aware of, in public health and through these chambers, we have tried to establish strict criteria, A, for prescription, and B, for monitoring. So therefore, we know what is prescribed, A, and B, we are closely monitoring who's prescribing. So through you, Madam Speaker, will those rules and regulations apply to these prescribers who are family members? Through you, Madam Speaker.
Representative Stastrom.
Thank you, Madam Speaker. To the best of my knowledge, they will.
Representative Srinivasan.
Through you, Madam Speaker, when a prescribing physician or a healthcare provider is prescribing to a family member, and that family member's medical records, is not basically the patient of that prescriber, but happens to do so because the provider is not available for whatever be the reasons. Through you, Madam Speaker, will there be a system of documentation when the prescriber gets back to the office at the end of a weekend or a long weekend? So therefore, that information is then sent over to the appropriate primary care physician. Through you, Madam Speaker.
Representative Stastrom.
Thank you, Madam Speaker. I do not see language to that effect in this amendment, so I believe if that is the practice or in statute, otherwise it remains unchanged. I will note that it is my understanding that this language that we see in lines 91 through 118 was drafted in consultation with the State Medical Society. Through you.
Representative Srinivasan.
Through you, Madam Speaker, maybe because of the background noise, I couldn't hear that clearly. What I wanted to be clear about is, since the prescriber is not the primary care physician or the one who normally provides services, will this information of, say, 48 hours of prescription or 72 hours, in what form will it be sent over to the family physician or the primary care physician or the healthcare provider? Through you, Madam Speaker.
Representative Stastrom.
Thank you, Madam Speaker. Madam Speaker, as I said previously, it would be sent over in the same manner that it always is. This language here in the amendment does not change other customer practice in our statutes or regulations. Through you.
Representative Srinivasan.
Through you, Madam Speaker, the only difference here is this happens to be an immediate family member. And since it is an immediate family member, the healthcare provider may not have the necessary records, is not the primary care or the provider, and that is the concern. Through you, Madam Speaker.
Representative Stastrom.
Okay.
Through you, Madam Speaker, could the good representative please repeat or rephrase the question? I'm not sure I caught it.
Representative Srinivasan, would
Through
you
Madam
please repeat the question to Representative Stastrom?
Through you, Madam Speaker, I think the good Vice Chair has answered that. As he said, these are practices that have been followed through the guidelines for the Medical Society. And if that has been so, that is more than adequate for me. Thank you, Madam Speaker.
Thank you, sir.